Good evening, everyone. Welcome to the body's response to the pandemic. My name is Angelina Taylor, and I'm the Executive Director of Aspen Strong. We are so excited to be bringing this discussion to you tonight in partnership with Aspen Valley Hospital. It's part of our shared commitment to mental health and well-being. This is the second in a 4-part series that we're doing this year, highlighting different mental health topics in these community presentations. Tonight's presentation, we will be touching on the physical response to the pandemic and how it has manifested in the heart, brain, and body. For those of you that don't know about Aspen Strong, we were founded as a response to Pitkin County's overwhelming suicide rate. We're a mental health advocacy group that believes normalizing mental health starts with talking about it. We promote mental wellness practices and connection to mental health resources in the Roaring Fork Valley. With me tonight is Jennifer Slaughter, the Chief Marketing Officer of Aspen Valley Hospital, to talk a little bit about the hospital.
Yeah. Hi, everyone. Can you hear me okay? Okay, wonderful. Thank you so much to Aspen Strong. It's a thrill for us to partner with Aspen Strong to bring tonight's important discussion to all of you. And the hospital and our entire network of care are really dedicated to the health and well-being of this community. As we are slowly making our way out of COVID, we absolutely understand that prioritizing and caring for our mental well-being is essential. And it is a foundation actually for complete physical and emotional self-care. So it's a really important event tonight. And I'm so excited to hear from our panelists as they share their professional expertise and their personal experiences with us so that we can all learn and benefit from one another. I certainly know that I will get a lot out of this tonight. We've all been through a lot, and these kinds of events I think are really helpful in connecting those who are in need with the right resources, which is why we're all here. So thank you, Aspen Strong, once again for this opportunity. Thank you to our panelists and to all of you at home who are joining us tonight. We look forward to collaborating more with Aspen Strong later in the year. And yeah, I look forward to everything tonight. Angelina, take it away.
Awesome. Thanks, Jennifer. So I'm just going to go ahead and introduce the panelists to you guys. We have Dr. Karen Locke tonight. Karen has been practicing medicine in the Roaring Fork Valley with her husband, Kelly, since 1999. In 2019, the Locks partnered with Aspen Valley Hospital to start Aspen Valley Primary Care. Dr. Locke studied biology at Colorado College before earning her medical degree from the University of Kansas. She completed her residency at the University of Wisconsin, Eau Claire Family Medicine Residency, and is a board certified by the American Board of Family Medicine. So thank you for being with us tonight, Dr. Locke. We have Christy Nichols, who's a Colorado native and has been working in the Roaring Fork Valley over 30 years. Her counseling practice, Designed for Wellness, is focused on people with treatment-resistant depression and anxiety, suicidal ideation, and PTSD. Her specialties are somatic psychotherapy and ketamine-assisted psychotherapy. Her experience has shown these therapies work well in achieving more timely and durable relief for her clients. Thanks for being here, Christy.
Thank you.
We have Lori Krett and Jeffrey Cole from Aspen Relationship Institute. They are married, licensed therapists and board certified coaches specializing in couple-to-couple coaching. Together, they provide clients with the insight, awareness, and guidance to create healthy, intimate, and fulfilling bonds. They established Aspen Relationship Institute as the culmination of years of experience guiding couples to fulfillment and their own profound passion for authentic connection. Thank you guys for being here. And lastly, we have Sean Van Horn, who is an endurance athlete in the Roaring Fork Valley and is a strong advocate for mental health in the community. While he has spent 20 years competing as an elite athlete, during much of that time, he was battling with psychological issues such as depression and eating disorder. Sean is unabashed in sharing his own struggles in the hopes that it can aid others and help to erode the stigma surrounding mental health disorders. So thank you, Sean, for being here. Just a few housekeeping items before we get started. Thank you to everybody that sent in questions so far. We will address those through the presentation. If anything comes to your mind during the presentation, please feel free to type the question in the chat, and I'll try to get to that the best that I can. You can, there's an option to make questions anonymously if you'd like to do that as well. And you can just send them to the panelists if you'd like. So we are recording the presentation and it'll be live on the Aspen Strong and AVH websites, as well as our social media channels within the next few days. And we'll send an email out to all of those of you that signed up just to let you know when that's available to share. So with that, let's get into the juice of this. Dr. Locke, I'll start with you. So there's been a lot of discussion mulling about that we as a population have been in this kind of state of chronic stress, and we've not had a lot of time to decompress and improve our overall function due to that kind of chronic stress. Can you talk about that and what that does to our mind and how that affects our overall well-being? Let's see, you're muted. Hang on, you're muted. There you are.
Can you hear me now?
Yeah.
Awesome. Okay. So this is such an important topic. I thank Aspen Strong for bringing this to the attention to the community. We see the effects of stress on the mind and body on a daily basis in the clinic. And what I think a lot of people don't realize is how much stress actually affects the brain itself. And that's something I'd like to address. It interferes with our cognition, our attention, and even our memory. The brain has certain resources that it uses to do its work. If you're stressed, the body releases stress hormones, which we all know about. They cause certain area of the brain to wake up and do their job. The amygdala and the hippocampus, for example, work to activate the fight or flight response. So that's what's happening when we're stressed, is our body's doing the fight or flight response. As our brain shuts energies to, or shunts energies to these areas of the brain, there's other areas of the brain, such as the areas that store memory or perform certain tasks, that get less energy. This is why you get more forgetful when you're under stress, or you can't get anything done. There's some evidence that stress over time can actually rewire the brain. The prefrontal cortex that manages higher order tasks gets attention compared to the other areas that handle the stress that we're talking about. And we lose some of the function in those higher areas. Chronic stress can actually cause shrinkage of certain areas of the brain due to lack of activity, just like if you're working out certain parts of your body. Some get more energy, get stronger, and other areas don't get as much energy and get weaker.
Thanks. So can you speak to the research that's coming out that's showing like nearly 1 in 5 people the diagnosed with COVID is like experiencing a psychiatric disorder like anxiety, depression, or insomnia within 3 months of diagnosis, and like what that might mean for long-term mental health care programs?
Sure. So actually this phenomenon is bidirectional, meaning that some people are diagnosed with psychiatric disorders after experiencing COVID-19 infection, because actually people with psychiatric illnesses have a 65% more are more likely to get COVID-19, which is kind of an interesting statistic. But on the other side, COVID-19 infection itself has impacts on mental health. These are multifactorial. The greatest impact we're seeing is in people who have had the severe infection. So this is the psychiatric aspect, not the long COVID aspect. So if somebody's had a more severe reaction, or infection, they may actually have aspects of post-traumatic stress disorder, which is a long-term reaction to a stressful event from the hospitalization or treatments that they may have had. They may have flashbacks, difficulty sleeping, anxiety, and depression with this. And there's so many other factors after somebody may have experienced a COVID-19 illness, like economic effects. They may have had lost income during their illness. They may have been isolated from their loved ones or had fear about infecting their loved ones. Decreased personal freedoms, feelings of one's own mortality, side effects from medicines, decreased access to mental health just because of the isolation aspect, and then constant reminders in the media. So all these factors can contribute to psychiatric disorders after the illness itself.
Thanks. We have a question from the audience. Is there any evidence of people having lower energy and fatigue after being vaccinated?
So that's a whole nother topic, I think, the vaccine. So the vaccine can definitely cause side effects, which is the immune system kicking in. We're kind of seeing the antibodies that it produces are a little bit different than what the COVID-19 infection response is, even though these work very well to fight infection. So the symptoms tend to be much more short-term, meaning you may be tired or have a low-grade fever, chills, but they usually don't last more than 3 days.
Thanks. So I think with a lot of that, the stress that we're experiencing from like the overall stress of the pandemic, the vaccination stress, the stress that we've had, and if those of us that have gotten COVID, it seems to have also put a bit of strain on our relationships. So Lori and Jeff, I was wondering if you could speak a little bit to relationships and how people's coping strategies have changed, and how couples can kind of give each other some grace and keep from jumping to conclusions that something is broken in their relationship.
Yeah, I think starting, well, thank you for having us and being part of this, first of all. But even to piggyback on what Dr. Locke was saying about the fight or flight, you know, our more neurotic coping mechanisms tend to be the fight or flight. And when we get stressed in relationship and when we have elevated emotions, we go into a very similar kind of fight or flight experience. Our brains really don't know the difference between a physical threat and an emotional threat. So we have that same kind of response. And in relationships, we talk about attachment theory and attachment patterns and the ways that we attach to our partners. And with the fight or flight, there's also sort of that polarized reaction in relationship. And we call people who tend to be more in the flight oriented avoidant attachers, meaning they shut down or they avoid the situations or they actually get up and leave. And people who are more in the fight realm are more anxious attachers, and they tend to be people who want resolution, want connection, sort of to the extreme of sort of poking and really trying to get a response from our partners. And so in this time of COVID, we've seen much more elevated fight or flight responses within relationships. So those tendencies, those anxious or avoidant tendencies, tend to be much more prevalent. And it's a really good time to recognize those in ourselves. There's some great assessment tools, free assessment tools online. There's some great books about attachment theory. And it's really wonderful to know what your tendencies are and what your partners are, so you can recognize when you might go into that fight or flight mode as a response to some stressful or emotional experience with your partner.
Do you have, I mean, I think when you talk about that, I can know which one I identify with, but if people are interested in figuring out who they might be, I don't know, people might already have the same reaction to that as I do, but if any of those books or resources that you could let us know about off the top of your head. Or
Yeah, I think one of the best ways is to think of it as a tennis game. And if you're more comfortable at the baseline and sort of hanging out back there, or if you're more comfortable at the net, really trying to push engagement. There's a book called Attached. It's it's a pretty good reference. It gives examples of different combinations, whether it's anxious and avoidant, or too avoidant, or too anxious. Sue Johnson also has a book called Love Sense that goes into it pretty much in depth. I don't know the link to some of the free assessments, but you could just Google free attachment assessment.
We can actually send you the link that we use, and you can post it as a resource for Aspen Strong.
Perfect. Yeah, that'd be awesome. So let's see, how kind of has COVID pushed people to kind of explore like their sense of their own identity and individuality within a relationship? Yeah,
that's actually a big struggle for a lot of couples. Time has just shifted through COVID. The use of time, our patterns, our structures, our schedules, for most people, they have changed pretty dramatically over the last year and a half. And so couples who don't live together have had to spend more time, or had the opportunity to spend more time exploring themselves and their own identities. But couples who live together and ended up spending way more quantity time together than in the past, a lot of them have kind of lost their sense of who they are as individuals. And so it's a really great opportunity as we're moving into spring and as things are starting to open up again, to take the time and reflect on what aspects of yourself have kind of taken a back seat or have been shelved over the last year, and what might be helpful to re-engage in order to kind of reroute in your own sense of identity.
Do you have any like relationship, like specific kind of tools or tips that you could use to that end? Like, or is it kind of more of a personal preference? Is there a kind of does that make sense? Something that you would recommend that people could do to explore that?
Yeah, I think the best way of thinking about it is that we often get a lot of our sense of identity sort of thinking about our relationships as a mirror, that the people that we have relationships with, obviously our primary partnered relationship is the most important, but that all of our relationships are in some ways a mirror to reflect back our identity. And as through COVID, when a lot of those other mirrors aren't present, because we're not going to work, we're not going to social events, we're not hanging out with our friends, we really have only had one mirror to reflect that sense of identity. So I think, as Lori said, moving into where things are opening up again, really use some sort of intention, mindful intention around reestablishing those mirrors, reestablishing those relationships, and recognizing the value of those relationships, and seeing that, and possibly, having some gratitude for even coworkers. I mean, that in some ways, they are a mirror for us as well, but that there's some intentionality as we re-enter, more deeper connections, or even more connections, and sort of have some awareness around what those relationships and those mirrors tell us about ourselves, and how they might resonate with how we feel about ourselves, and how they might not. But I think this is a great time, as we're reestablishing those connections, to recognize what we get back, what we get reflected back from those relationships all across the board, from partners to friends to work to just social groups and things like that.
Another great question to ask yourself is, how would you like your partner to be different right now? Because that's often a reflection of what part of you need to spend some time nurturing or building or reestablishing. Like, if you want your partner, if you wish they were more social, if you wish they were more spontaneous, if you wish they were more health oriented, in order to help you become like that, you kind of have to take your partner out of that equation and look at what's the work that you need to do to get there for yourself.
Oh, I like that. That's good. Thank you. I think because of a lot of the isolation, and like you said, like not having these mirrors, if you will, of who we are, and losing a sense of ourselves, many of us have turned to what we consider bad habits. in a response to the pandemic, over drinking, overeating or undereating, compulsive television viewing. Sean, I was wondering if you could talk a little bit to your journey with depression and your eating disorder and how you were able to recognize that it was unhealthy.
First off, thanks for having me. I am less of an expert and more of a patient here, likely. I definitely have struggled through a lot of things, and I suppose all I can really do is share my story. So my eating disorder wasn't birthed out of vanity. It didn't come out of desire to lose weight for sport and perform better. It came at a time in my life when I had pretty much all control stripped away from me. I think something that we can all relate to with COVID. And I had lost some of the previous bad coping mechanisms that I'd had in the past, namely drugs and alcohol, and ended up shifting towards something else, and wasn't even completely conscious of it or conscious how it came about, but it certainly became a problem. And while I recognized it was a problem, likely pretty early on, it certainly didn't seem normal. It took a very long time to get help. And unfortunately, that's something that is not uncommon with any mental health disorder. Often it can take years. It's shockingly long for people to actually go get professional help. It can be very difficult for a lot of us, men and women, to admit that we have a problem, to admit that some of our behaviors have become disordered in some way. And that is certainly the first step to get to, and recognizing you have a problem is the first step. But so unfortunately, these are generally not issues that we can think our way out of. Our brains got us to this point. And I think getting help is far and away the most important part. I got help for depression, for substance abuse pretty young, but my eating disorder was something that I kept private. That even though I was going to see psychologists and psychiatrists and whatnot, I didn't broach that subject. I assume, and come to the conclusion, is most of it was out of shame. And I think that's why, like, the work that Aspen Strong does and so many others do to eliminate some of the stigma around this is so important. Because even now, talking about my eating disorder, I still get twinges of shame. It's a difficult thing to do. And getting help, talking about it, has taken away a lot of that shame and has helped me heal from a pretty deep place, and has had ramifications throughout my life.
Was there something that served as like the catalyst for that that decision?
It was really starting to affect areas of my life in a very intense way. So to get specific, I essentially was anorexic for years, and then at a point it turned into exercise bulimia, and that was impacting my life in such a way that other people really took notice. Even though I was deeply struggling before, my friends and family did not notice. And as it started to impact them and very vividly impact crucial areas of my life, to get back to what Jeff was saying about a mirror, other people reflecting back to me how much of a problem it was, and how unmanageable it was. And that's when I did get help. I would hope that most people don't have to get to that point where it is negatively impacting their life so much, and that they can get help a little bit sooner.
Thanks. Do you have a toolbox that you tap into when you notice yourself kind of heading back in that direction that isn't good for you? Any like tips or tricks that have worked for you that you would be willing to share?
Yeah, I'm going to say here a little bit again, I think in some ways I can be an example of what not to do. So unfortunately, during this COVID period, when it first started, there's a lot of uncertainty for me and for a lot of people. My hours were cut back at my job. I didn't know what was going to happen, and I run a lot, and I started running a lot more. And that's something that can seem like a completely healthy coping mechanism. Exercise. What can be wrong with exercise? But it's a flight mechanism. Exercise can be a fantastic way to disassociate from the problems in your life. So I suppose one of my tips, my tricks, is just to face the issue head on. To deal with it, to talk about it with your loved ones, again, to get help and talk about it with the person that you're getting help from. I suppose another important aspect is to practice self-love. That's been a massive thing for me. That is an underlying issue with so much of this, is to practice positive self-talk and to combat some of the negative thoughts that constantly dance around my head. There's certainly, other little things that I do, whether it's, meditating, journaling, talking honestly with loved ones. But I suppose I also can't reiterate enough that if these issues in your life are disordered, if they're getting to the point where they're impacting your loved ones, your work, your mental health, probably first and foremost, get help and find someone that can help give you some specific tools to overcome some of the stuff you're struggling with.
Awesome. I think it's amazing that you're so outspoken about your journey. I'm sure like at times that's probably challenging to be so vulnerable, but in a way also healing at the same time. So thank you so much for sharing your story and just sharing what you do with us.
Thanks for having me.
Christy, can you talk to us a little bit about a coping mechanism that you're super passionate about? I know I guess, would you call it a coping mechanism? A modality, I guess, of somatic therapy and how we can use some of those tools in our everyday life.
Sure. First, again, I'd like to thank Aspen Strong, AVH, and Angelina, you for putting this together, and also the other panel members. And I really appreciate the information that Jeff, and Lori, Dr. Locke, and Sean have already expressed on the panel. So I'm a somatic therapist, and specifically I work with how we experience events in our lives. So I'd like to kind of change it up a bit here and do a little exercise or experiment with me, if you would. And go ahead and close your eyes if you're comfortable, if you're in a safe place to do that. Just close your eyes and try to take a few breaths through your nose. And as you're doing that, I just want you to imagine it's a beautiful summer day in downtown Denver. Notice the smell in the air. Notice how the sun feels on you. The excitement and the people around you. But suddenly you notice a low-flying plane heading into the city. Suddenly you can hear it close enough. It's close enough that you can hear it. So now as you sit there doing this experiment, I want you to notice in your body what happened as soon as I said you notice a low-flying plane heading towards the buildings. And just sit with that a bit. Notice what it did to your breath. Notice if suddenly you're holding your breath, or if you had tingling or some other distressing somatic response. So our midbrain is always making an assessment if the environment we're in is dangerous or not. And, you know, first, if there's no danger, we can be spontaneous. We can engage in life and not have any worry. Go ahead and open your eyes. But if this midbrain detects danger, then instantly the fight flight mode is activated and we're energized. And Dr. Locke and Jeff and Lori talked a lot about that, and Sean, you know, that fight or flight is energized for us to respond to this danger. We're agitated and we need to do something. The third response we can have is our lives are threatened. It can be such an incredible, overwhelming feeling that we freeze or feign death or die. And if you think about the gazelle being chased by the lion, and sometimes those gazelles just suddenly drop down and the lion is smelling around them and maybe gets distracted, and then the animal can run to safety. But freezing, feigning death, dying, we see that as depression. So from how our brain works, we're either going to feel safe, we're going to have our fight flight activated, or we're going to be threatened. And this is an involuntary process. You really didn't have a choice in how you would react, you know, to suddenly being disturbed by a plane. I mean, you know, instantly our brains will probably go to 9/11 because we've experienced that in our history. So how does that somatic awareness help us? In our behavior, we may have a great plan on how we're going to respond to a particular situation, but when this involuntary part of our nervous system is activated, the only way we can learn to move on from that is just realizing what happened and realizing that without judgment. And so now here we've been in a pandemic for over a year. Fight, flight, depression, all of those buttons are getting pushed, even life threat. So what do we do with all that activation? You know, here's where these behaviors that don't help us really come into play. These obsessions with the news, poor sleep, substance abuse, eating disorders like Sean talked about, and even over exercise. Or if we're depressed, maybe we're not, or we're sleeping too much. Maybe we're not interested in our bodies really going into shutdown. So that's where somatic therapy works in the midbrain. We learn how to understand why our body is reacting this way, in this involuntary way, and then learn how to create neural pathways that can teach us ways to use that information and have new neural pathways and have a more healthy reaction to the threat.
Can you talk a little bit about how, if we tune into those feelings in our body, and rather than using our thinking brain, kind of how, I know you do a lot of work with kind of recognizing that feeling and recognizing the feelings in our body and helping that to kind of calm ourselves down. Can you talk a little bit about that process?
Yeah, and this is my passion, so I could talk about it for hours, but I'll try to make it brief. If our brain is activated and seriously we're in fight flight mode or freeze, feign death, die, we really need to ground our brain first. We really need to honor that, and also basically just distract it, kind of throw a wrench in it. You know, so right now I'd just like you to think about your feet. Think about what your toes feel like. Think about what your toes are touching right now. Notice if your feet are hot or cold. Look around the room, notice colors. Notice if there's something yellow in the room or red or orange. Notice your breath. Breathe through your nose. Feel the air going through your nose. Things like that can calm that active brain pretty quickly or just distract it. And the best thing that we can do to tune back in is just being aware of if we're being activated, fight, flight, freeze, feign death, die. Notice what it's doing to our bodies specifically. I like to teach my clients to just sit with the feeling. I don't want the story. I want you to notice what it feels like. If you're going to have somebody recreate it with a 3D printer and place it in your body, what would fight or flight feel like? Is it a tightness? Is it a metal orb? Is it a hot spot? And by respecting these sensations coming from our body, we can really learn not to be hijacked by them and be basically out of control and really engaged in these behaviors that are not helpful.
I like that. It's kind of, I think you and I were talking about, like, I use like the distraction when my 2-year-old son's like really upset. So, oh, look at this animal, or look at this, and oh, tell me the colors in this animal. It's funny that that kind of same method can work for us as adults, right? Like tricking our brain into thinking about something else.
Yeah, so if we're thinking about colors on the wall or our toes, that midbrain can get the signal that, hey, she must be okay. She's thinking about colors all of a sudden.
It's so interesting. I love that. So we have another question. I think we'll go back to Dr. Locke here. How is Aspen Valley Hospital preparing to address the needs of long hauler patients, and what kind of treatments are available for long haulers? And maybe there's some people that don't know what a long hauler is at this point. I don't know, but
right. I was actually going to speak to that, if that's okay, real quickly.
Yeah.
So the term long hauler, the CDC's putting all sorts of other terms for this, but it's post-COVID syndrome. It's the type of response that we see sometimes with other types of viral infections. They saw it with the MERS, and it's what we think of when people have a chronic mono infection, where they feel very tired. They may have aches, body aches, joint aches. And specifically with the post-COVID, we're seeing multi-organ effects of the virus that we think are related possibly to an inflammatory response and a dysregulation of the immune system. So what happens is the immune system is actually attacking the body. So then you get these symptoms in multiple organ systems, including the brain, the heart, the lungs. And really, I guess what I'd like to impress upon people is that if you're having more severe symptoms, an ongoing cough, shortness of breath when lying down, swelling in the legs, chest pain, you should really see your primary care provider, because there could be some organ damage going on that needs to be addressed. So the Aspen Valley Hospital primary care has developed a post-COVID clinic for people who don't have a primary care provider, but we really want people to see their provider if they have one, because they know your medical history, and it can be difficult to sift out chronic medical problems from what the effects of COVID are. So your primary care provider is the best person to do that. So that's where you need to start with the medical issues that are happening post-COVID. But again, the Aspen Valley Primary Care does have a specific clinic run by our physician assistant for those who don't have a primary care provider. And then I think very importantly, Aspen Valley Hospital has organized a post-COVID support group. And this is where a lot of the attention has been placed in the medical community for treatment of post-COVID, because it is a difficult thing to treat and we don't know a lot about it. And these support groups can be invaluable. They're meeting via Zoom once a week with our mental health provider. And you can access signing up for that on the Aspen Primary Care website. And I went on there to see where it was. You kind of have to scroll to the bottom, but it's very easy to enroll and there's still spaces available.
Thank you. So I think with long-term effects of COVID also come kind of long-term effects on our relationships. Kind of, Lori and Jeff, could you speak to like, will this have a lasting impact on how couples spend their time together and how couples can deepen their connection?
Yeah, so, you know, whenever we're in a pattern for a period of time, whether it's 3 months or 6 months or more, we start to shift and adapt to that pattern, and that becomes the norm. So couples who have been spending all of their time together can very easily become complacent in the efforts that they put into creating quality time, into how they actually treat and show up for each other, and the amount of energy and effort that they put into the relationship. And so one of the things to be aware of for couples is just noticing how they spend their time together and how they are interacting with each other, and whether it's working for them or not. My sense is that a lot of couples that we've been seeing have gotten into these places of complacency that just aren't fulfilling, and the connection and the bond has really kind of eroded over time. And so it doesn't mean that it has to continue that way. It can easily be shifted by just putting some conscious effort into creating more quality time and going back to the efforts that they put in the beginning of the relationship. When you were first dating that partner, however long ago that was, what were the little things that you did to make them feel special or known or loved, and the things that we have sort of taken for granted, and would be important to kind of bring back in a really thoughtful, mindful way.
Again, like kind of any tips and tools for, I know like when we get into patterns, it's hard to break them. So do you have any like tips on like how to break those patterns? I mean, is this just like that conscious effort, or is there, do you have any advice on that, to that end?
Yeah, you know, I think it actually, I always say it seems a little awkward at first, but it's really trying to create some, whether you want to call it ritual or just sort of regular intention. One of the things that we do is I tend to get up a little earlier than Lori does, and as she comes downstairs every morning, I get up and we just have a hug. I mean, it's sort of like that's the way that we start the day, and then we are very mindful and intentional about like even leaving sticky notes, just you know, around the house, or you know, texting with a little emojis or something. And you know, the two words thank you, I know it's, again, it's sort of sounds really trite and kind of silly, but it's amazing how far those two words go, even for the most mundane things. So it's really trying to bring back that sense of appreciation and gratitude, even if it's just for a you know, again, a very mundane action or exchange. And you know, it's, as Lori's saying, is we really, during this time, we've really taken our partners for granted, and the expectations that we have, kind of back to that mirror idea, that our partners are really everything to us now, because we're not socializing, we're not, you know, doing the things that we normally do, and even maybe taking some time to appreciate and thank your partner for helping you get through the pandemic. But it's just that those small regular intentionalities, whether it's ritual, whether it's just these sort of practices that just remind each other that you chose this person to spend your life with, or however long you're planning to spend with them. But it is sort of that grateful intention in those small little pieces that happen throughout the day that really make the difference.
I love that. I love that you guys do that. That's so cute. I could definitely do more of that. And we have a question. Sean's comments on exercise as a coping mechanism really resonated, but I also recognize that there's a fine balance to be found. I wonder if the panel could comment on mechanisms for how, when one can identify that their exercise or other patterns are actually damaging, especially in the pandemic where our daily routines and behavioral patterns have been so significantly changed.
Do you want me to take that? So I do think it's a really fine line. And I can speak to exercise particularly, I suppose, to other coping mechanisms as well, other external coping mechanisms. So athletes give a lot of lip service to listening to your body. Oh, I listen to my body and that tells me when to rest. But I think, unfortunately, as an athlete, often you become pretty dissociated from your body, that we continue to press on in a race or in training despite our brain giving us pain signals, that we get up and go for a run or a ride or a ski in the morning despite the fact that we're tired, because it's what we're supposed to do. It's what we want to do. It's how we're making sense of our day and maybe creating some meaning in our lives when nothing else makes sense. So I think for a lot of it is actually, to kind of tap into a little bit what Christy was saying, is to really try to tap into your body and to listen to some of the signals that it's giving you, instead of just following a plan, doing what you think you should be doing, tapping into some of those deeper signals that your body, that your brain might be giving you. So, if you're waking up and you're really tired in the morning, if you're crankier than usual, if you're not able to sleep at night, any of those disturbances can certainly be a sign that your brain and body are crying out for some respite. And the honoring those is actually going to make you a better athlete in the long run too, and a better person.
Christy, did you have something to add to that?
Sean voiced it perfectly. I feel like if you sit long enough with the idea that if you notice what it does to your body when you think about, obviously if you're more into endurance, and maybe even not, you just need to go out and do a 5K. Sometimes your brain is instantly going to say no, but just sitting with that, sometimes your body will give you more information. It just might be a word or an idea. I'm tired. I've done enough. Maybe I should go slower today. But our cortex likes to jump in and make up a story. Oh, you got to go keep up with whatever, Strava, or someone else is doing this and that every day. And that's fine to have that briefly, but the real nourishing part, the real corrective part, is after that thought, see what it feels like in your body. Maybe you're going to feel exhausted. Maybe an injury will hurt, but maybe you're going to stack your spine. Maybe you're going to pop right in and feel like, hey, this is the right thing to do.
Thanks, Christy. Another question. Couples think they need counseling when things have gotten really bad, but how do you get them to see that any relationship can be improved?
So we really take this coaching model perspective because we don't want it to be a response to when things are really falling apart or feel like they're broken. Everything else in your life you maintain your car, you maintain your health, you maintain your friendships. Why would you not think that the most important relationship in your life could use a tune-up once in a while? It's really painful for us when we have clients come in who are at the point of figuring out whether to stay together or not, and they say, if we had only done this 2 or 3 years ago, maybe we would not have gotten to this place at all. And so for us, anything important in your life requires maintenance. And we do this work and we live in this relationship, and we still are constantly having to get support and resources for ourselves because we're human. And relationships are complicated when you put two individuals into the same life, and you're constantly having to rebalance that and titrate that and create new norms. So we just really want to normalize, just like you guys are doing with mental health, that relationships are challenging, and it's okay to reach out and get some support.
Yeah, I really think, trying to remove the stigma from all kinds of counseling, and what we do use the word coaching, and a lot of times the idea of coaching is not to take something broken to fix it, but to take something that's working, but just to make it work better. It's unfortunate sometimes that we have to use the word coaching to remove some of the stigma from the counseling part of it, but we do, and that's okay, as long as we're really trying to reach people who can understand that. And as Lori said, I think, our first thing that we say is relationships are hard. We are technically experts at relationships, and our relationship still takes work. And so, getting help oftentimes is a really difficult thing for people. But I like to just say, if you get, lots of people get life coaches, lots of people get personal trainers. That's what we do for your relationship. And there's no shame in it. It doesn't have to be broken. And we also believe that relationships can be one of the most, or the most beautiful thing that we experience in life. And, it's sad to think that people aren't getting their needs met. It's sad to think that people are, believe that this is just as good as it gets. When we know, that the possibilities really are endless and limitless.
Have you seen any like successes in couples? Like if there's one person that it thinks it is stigmatized for them, one person in the relationship is resistant. Is there some successes you've seen in another partner convincing their partner that it's something that would be beneficial for them?
Yeah, I mean, it's funny. It's usually the guy.
The guy that convinces the girl?
No, it's usually the guy who doesn't want to go into therapy, and the female partner is in heterosexual relationships. The female partner is the one who, either gives an ultimatum or, somehow convinces. And I think our model where it's couple to couple helps with that a little bit, because I think men who come in to work with us see that, we are doing the same work that we're asking them to do. And that, for me as a guy to be encouraging other men to explore their emotions, to show up in more of a emotionally intimate way, to look at physical intimacy or sexuality in a different way. I think it shifts their mindset a little bit. The challenge is getting them in the room. But what I would say to men is that if you want to enhance your connection, that some sort of coaching or counseling in that direction is going to do that.
Thank you. So another question we have, I actually just read this article, so I'm excited somebody's asking about it. There's a new report out there, first referenced in the New York Times recently, about the state of languishing. Can you speak to our collective state of mental fog, fatigue, general meh, that feels like it's happening right now? Anybody want to field that one?
Yes, I can speak to that. Again, in how our brain is activated. When we're in fight or flight mode or threat of death, a big part of our neocortex shuts down. Only about a third of it is available to problem solve, to take in, to be aware, because we're literally being triggered to run for our lives, fight for our lives, or play dead. So the brain fog is kind of on that lower scale of freeze, feign death, die. And our body actually has a way, our brain, our neurological system has a way of really preparing us for death. So maybe either one of those things, the lack of access to all parts of our cortex, or that other part of our brain that's literally shutting down, trying to make it a more peaceful experience if we suffer death.
Is there something that we can do? I've read a lot of things like people are staying up later and watching TV shows because it's like escapism, so that they can kind of regain some of this freedom, if you will, of like this time that they've lost, or feeling like they're losing themselves in a story. And like, is that a healthy response? And are there other things that we can do to kind of, I guess, bring back some of that joy?
I can keep answering these questions unless somebody else wants to chime in, because this is my practice. And right now my clients, they're already triggered, are even more triggered right now, whether it's an activation with fight flight or loss of activation with this freeze, feign death, die response. So I feel like the way we deal with something like wanting to watch TV all night is realizing that's a pretty strong urge if you think about checking out as an option or a distraction. So I just encourage my clients, if that's what they're doing, go for it, check it out. And then afterwards, notice what your response has been. Was it helpful? Do you feel better after you stayed up all night watching TV? And possibly next time you have that same urge, you can feel it coming on and acknowledge it and notice what it feels like. And then give yourself the option of doing something else. What would feel better than sitting there and watching TV all night?
Thanks, Chrissy. I'll take this one last question, and then it's just a simple question. Lori and Jeff, do you guys only see heterosexual couples, or do you see?
Nope, we see everyone.
You see everyone? Okay, thanks. I thought we could end, we're about a minute out from ending. I thought maybe we could end on a positive note. I know a lot of people have been talking about silver linings, and I wonder if everybody could just go around and talk about some of the silver linings that you've seen with the pandemic. So Dr. Locke, we'll start with you.
So speaking about the couples, I've seen that people have actually grown together as couples, taking the opportunity to, I guess, pay more attention to each other and do things together. And some families with their children too have reconnected and done things when they've been stuck together in the home. And so that's been a little bit of a silver lining, is reconnection with family and loved ones. There's the whole isolation bit, but within your nuclear family.
Thanks. Lori?
One of the things that's been really powerful is sort of this pause that has been put into a lot of people's lives, where we just become consumed with all of the distractions, and it's really been a place for people to slow down and to see what's important. One of the challenges has been that in the quiet, issues that have been simmering under the surface have kind of risen, which can feel stressful or challenging, but it's really a beautiful opportunity to kind of clean up and make adjustments that would serve people in the long run if they're willing to take advantage of it.
Yeah, I kind of compare it in some ways to the practice of meditation. And for me, meditation isn't about relaxation. It's about being still and sort of and removing distraction and see what comes up. And I think this pause really has done that for a lot of couples, where a lot of the distractions and a lot of the routines have been removed and changed, and a lot of stuff has come up, and it's been really, on one side, it's been really hard for couples because they don't have the tools to work with it. But on the other side, if they choose to address it and work with it and look for the opportunity to reconnect, it's been an amazing experience.
Thank you. Sean?
So the first half of the pandemic, I spent running a lot and achieved some pretty amazing goals for myself. But as I mentioned before, it was a bit of a flight mechanism, and to say it wasn't is a little silly. And I kind of broke myself. I effectively have a sort of overtraining syndrome right now, and have for the second half of the pandemic, the last 6 months. And it has not been fun, but what it has allowed me to do is, or forced me to do, I suppose, is to dig into my mental health. It's one of the main things I've been able to find that's medically wrong with me is my brain. And so I've experienced a lot of growth. I've really started to explore some areas that have, maybe been neglected over the last few years, that where instead I've been focusing on endurance sports and achievement. For example, I'm working with Christy right now as part of that process. And while it maybe took some damage to get here, I think for me, I'll come out of it with some of the most personal growth I've seen in the last decade.
Thank you. Christy?
I see a lot of success stories. The pandemic's really dragging on, and people really, just like Sean said, you can be distracted only so much, and then you can break yourself. But also we lose a lot of these other coping mechanisms that don't really serve us. Going out to the bar, excessively drinking, and really seeing, what quality of life we're allowing ourselves to have. So in my practice and in my own life, I feel like I've learned a lot of skills. If I wasn't able to do the things I normally did, and I was able to find other things to give me self-esteem. And my clients are doing the same thing. They're really able to see, what they would like to change, and they're going for it. I'd like to say the mental health stigma is dropping away a bit, but I don't really believe that, but I feel like we've been able to stop and examine ourselves.
Thanks. I'm getting questions about your guys' website. So Jeff and Lori's website is aspenrelationshipinstitute.com, right? And
AspenRelationshipCoaching.com or AspenRelationship.com. Either will take you there.
Okay, can you type that in the chat? Do you know how to do that?
No.
I'll do it. What is it? Aspen Relationship. Sorry. Aspen. Sorry, can you say it again?
AspenRelationship.com.
.com. Okay. And Christy, yours is Design for Wellness. Well, I would say one of Aspen Strong's silver lining is that it feels like more people are open to talking about mental health, and it feels like we are, although it's a long road to hoe, I think, on making some healthy choices in helping to break the stigma behind mental health issues. So I appreciate all of you guys for being here today, and appreciate the audience for all of your questions. I put the Aspen Strong website in the chat, as well as our Instagram. Follow us on Instagram. We have lots of just helpful information and tips and tools to and fun quotes and stuff to help energize and bring joy to your day, as well as resources on our site for finding local therapists and taking quizzes, taking our mental health screenings to help you identify any issues that you might be having or others might be having. So thank you all for attending. Thank you to the panelists. Super appreciate it. And everybody have a good night.